Okay, you guys should be good to go.
All right, great. All right, well, we're a team again. Hi, everybody. I'm Laura, and Dr. Miranda Durham and Dan Burke are here today with us. So we'll go ahead and get started. We have some updates for everybody, and please feel free to ask questions. And once again, thanks for all you guys are doing in the community. So we're getting ready for a really busy time. So let's go for it. So I'll have Miranda go first, and then I'll finish up at the end. Miranda.
Awesome. Well, good afternoon, everyone. So here is the provider update. We do have our DOH mission, which we've reviewed on past meetings. Our COVID-19 overview. So this is just looking at, this is actually CDC data, but nothing new to anyone. Here's in the red line, our cases per day, so plateaued and even bumping up a little bit, and our percent positivity it does continue to rise. This is from the COVID Act Now website, the R effective, so how much spread there is from any one person. That number's on the rise too, unfortunately. And then, the good news, this is vaccine data, which is we've really had an uptick in the number of vaccines. That's mostly boosters, but, boosters are good too. And I think this just provides the setting for, I think it will be really exciting to have vaccine for kids. It is a large unvaccinated population. Hopefully, we know it'll be a struggle for some, but hopefully a group that will embrace vaccine and, could really potentially impact our cases. Here's our vaccine progress as it stands now at 82% of New Mexicans 18 plus with at least a first dose, and 73% of New Mexicans fully vaxxed. On the boosters, and again, I think we mentioned this last week, but having kind of the right denominator is a little bit difficult. What's on the website is just the all 18 plus eligible. And so all people 18 plus, so not just the people who are eligible for boosters. So the number looks low at 10.9% of New Mexicans who've received a booster. But if you do break it down by the people that are actually eligible, those numbers are better, like in the 30+%. So we are collectively making progress. So here's the boosters administered up until October 30th. So making good progress. Here's comparing the vaccine administration by brand. So really just put this in to show that J&J is a tiny amount of the vaccine that we did do in New Mexico, but people are getting second and third doses, the third doses being the third after a set of 2-dose mRNA, or someone who managed to get 3 doses. So the big thing is vaccines for 5 to 11. And again, not a lot new right now, except for the FDA did authorize the pediatric Pfizer, the orange cap vaccine on October 29th. That was last Friday. And the ACIP is meeting now as we speak to discuss pediatric COVID vaccine. And so we should have CDC recommendations by tomorrow evening, which really means we'll be good to go Thursday morning with giving the vaccine if people have it. So again, just to review, it's kind of the vaccine of 10s. It's a 10 microgram dose. It's 10 doses per vial. It's 10 weeks in the refrigerator. The 100 dose ordering will start on November 9th. So we've had 300 dose ordering to date. And then I wasn't really sure where to put it, but a topic that came up today for us, what if you turn 12 between dose 1 and dose 2? And the answer from Pfizer was you give the age appropriate vaccine. So you'd get an orange cap at 11, a dose of the orange cap at 11, then you turn 12 before you get your booster, and you get the purple cap then, the purple cap formulation.
Hey, Miranda, there's a In the chat that says, I have a diluent question on PEDS doses. Do you? have
All
any-
right, let's, yeah.
So this is Tanya. My vaccine arrived today. My diluent arrived and my ancillary kit arrived yesterday. My question is, the diluent they sent is 10 milliliters. And they sent 10 milliliter bottles that equal 300 doses, which means you need to run a clinic of 60 to 70 kids, which could be, we're talking to some schools, which may work, but it may not. Is there any reason why I can't move that diluent to my adult purple cap and use my 2 cc ones for the pediatric?
So it's having a little hard time hearing. I think you're asking, is the diluent interchangeable?
Yes, ma'am, because it's 10 cc's
Oh,
is
there
what
you
they
are.
shipped. Sorry, I just realized where my mic was.
Okay.
It's 10 cc's is what they shipped us for the PEDS doses. So it's 10 cc's and it's not like 10 times all the
Right.
vials. It's 10 for you to open that many pediatric doses, which means 7 vials of the orange cap. So I just wanted to know if it's okay for me to pull I run 60 doses of adults right now easily in one small setting.
You know what, I think, Joelle, are you on the call?
Yes,
And do you have an answer on that?
I don't at this
Okay.
point, but I am writing it down, and we'll be meeting with CDC and waiting to get some more guidance from them for all the official documentation today and tomorrow. So.
And I am watching the ASIP too.
Okay, great. Yeah, and I don't think I don't think there's a difference in the diluent, but we probably should just be sure. Okay. This is the remaining pediatric Pfizer training sessions, if people are interested. And then we wanted to take just a sec. We have gotten a lot of questions about sort of information for kids, and there's nothing specific to 5 to 11 on the CDC website yet, but there is this link that is sort of a page about questions and answers about, basically kid-related COVID vaccine. There isn't a thought that, the thought is that the side effects should be about the same as the ones for grown-ups. There is, of course, the little worry about myocarditis and pericarditis, which is very rare. Did not come up in the trials for pediatric Pfizer, but the pediatric Pfizer trials were, 2,300 kids. So possibly not enough people for a case to come up. So still something that everyone will be watching. Another good resource is this Pediatrics on Call podcast, and they're talking about messaging with parents and sort of suggesting, which I thought was interesting because I had never really thought about it, but rather than using kind of the fight, the metaphor with, the vaccines fight the virus, but trying to use language of the vaccines and your natural immune system working together. And so I thought that was sort of an interesting, maybe more gentle way of sort of explaining, and really more true way of explaining what's happening. On the pediatric allocations, again, vaccine is coming into the state sort of as we speak. Some people have gotten their orders, as you've heard. There were 3 initial waves of ordering that totaled 66,000 doses. Plus we have doses from federal pharmacy. So I think we think around 90,000 doses soon to be in the state. Let's see, I think most of these are the expected delivery dates, depending on which of those first 3 waves your order went in. And then just again, the weekly plea to just, because there's so much change and the vaccine program may need to get hold of you, please make sure that you're on the lookout for the NMDOH emails that do sometimes go to junk. and that your contacts are updated in NMSIS. On vaccine ordering, the NMSIS will open Friday for pediatric Pfizer Orange Cap ordering. And those orders will go to the CDC on 11/9. So the team's giving a few days for people to get their orders in. Also, the Purple Cap Pfizer adults or 12+ formulation is available again in 450 dose packs. The adult ancillary kits are including, let's see, I may have this, do include 20% of the 1.5-inch needles for larger adults. And the pediatric ancillary kits are supposed to include 100% 1-inch needles. We've had some discussion about like using 5/8-inch needles, but isn't really going to be an option if you're using the ancillary kits that are being sent. And then the Moderna, which again, I think we've talked about, but the Moderna booster ancillary kits are coming with, should be enough supplies for 20 doses from the vials, whether you have a 10-dose vial or a 14-dose vial. Let me pause there too. Joelle, do you have any other updates that you wanted to inform the group on vaccine ordering?
I just want to clarify about the Moderna ancillary kits. Those are for either if you order first or second doses, it doesn't matter. You'll always get enough to cover them. There's not a booster dose Moderna NDC, it's all the same. So whatever you order, you'll have enough to cover those. So if you are still needing Pfizer pediatric doses, I'll put my email again in the chat. Please reach out to me. We're, again, like Dr. Drum said, we're getting vaccine on the ground. So if we need to move doses, we can. And otherwise, go ahead and start ordering those 100 doses at the end of the week. Thank you.
Great. Yeah, thanks for clarifying on the Moderna. Awesome. And then, okay, Vaccine Finder. This is also, CDC is really paying attention to inventory in Vaccine Finder, especially for the pediatric doses. So this is also a plea to make sure that inventory is updated in Vaccine Finder daily. When it isn't updated and it looks like we have a ton of doses on the ground, but we don't, then that can sometimes adversely affect what allocation we get from the CDC. So especially for peds, but really for all, keeping that accurate is great. The other thing is that patients can find vaccine locations on vaccines.gov. As you know, they definitely can in the statewide app as well, but this is just another resource. So you can choose to list or not list your site on vaccines.gov. With links to however you are asking people to schedule, whether it's through the app or through like CVS just links their scheduling program. So this is just the reminder about Vaccine Finder. This question came up last week, vaccines.
Miranda, sorry, Miranda, there's a question in here on that regarding that here in the chat too. It said, I received the pediatric dose today and they say they expire 8/20/21. Is that okay?
8/20?
Yeah, it said 8/20/21 is the expiration date. So
Isn't that
I think that's the manufacture date.
okay. Is that what you're saying, Joelle? Thank you, Joelle.
So yes, you'll need to, with all the vaccines, since they're all under EUAs, you need to check on the websites. If you go ahead and email me, my email's in the chat, I can kind of help walk through some of those issues with you. So thank you.
Thank you.
Oh, shoot, that's a good point, because we were also hearing about extended dates for Moderna. So kind of the take-home message from the CDC is just keep checking the expiration dates on the, on the various websites that there are for checking. And we should, I should include that next week, those links. All right, so vaccines given outside the US, last week we did have a question about what to do for boosters for people who have gotten like a full series of AstraZeneca or one of the other um, uh, vaccines that aren't approved in the United States. And we have stumped the CDC panel. They basically just said there's no guidance. And, you know, I think no guidance kind of means we can't give boosters to that group right now, but you know, it is one of the many things that's still getting looked at. So this is just a reminder, this is really talking about the primary series. So if you've gotten a vaccine outside of the US that's not one of the FDA approved or authorized, because you know, you can also get Moderna, Pfizer, and J&J outside of the US, and that's fine. You don't need to do anything different. But if you get one that is World Health approved, but not FDA approved, and you've had the full series, you don't need to do anything else. You're considered fully vaccinated. If you've received only one dose of a 2-dose series that's World Health Organization approved, but not FDA approved, then you can start over again. So it's not getting a second dose of one of the FDA approved vaccines, it's just starting the whole series over. And then in 6 months, you would be potentially eligible for a booster, or if you decided to get J&J in 2 months, you'd be eligible for a booster. If you get a vaccine that's not World Health Organization approved and not FDA approved, then the recommendation is to just start over. And the link here is to that CDC page. And these are just the World Health Organization approved vaccines. So they include Moderna, Pfizer, J&J, AstraZeneca, and then these 3 others. And then this again is just the kind of Bible of vaccine pages on the CDC that, you know, should get updated once we have kids vaccine. So just a reminder about that. That takes us to RTS updates. And Chris, sorry, I didn't have a chance to touch base with you, but do you have anything for the group?
Yeah, no problem. Dr. Durham, we are preparing for the kids to be able to be scheduled by their parents. We'll be reviewing how you can turn on specific availability for kids. So if you want to reserve some of your capacity for children only in the app on a particular day, you can do that. We'll be looking at that on Thursday. The ability for parents to add their children or their dependents to their profile has been launched. We've had right around, I think it was like 15,000 profiles that had done that so far. So we're seeing a surge in that. I know the comms team is going to push that again. Excuse me, I have a dry throat. We'll be pushing that again at the press conference tomorrow. And then the digital consent, the mix and match boosters, and the flu vaccine is available all in the app as of today. So we'll be reviewing all of that functionality again on Thursday, primarily focusing on the new functionality for kids.
Great. And is it this same link Thursday at noon?
Yes, it's the same Zoom link.
Okay. And is the Wednesday meeting still happening or not?
What Wednesdays are for new providers that want to onboard. We require a training so that any questions about documentation or anything like that can be answered, and then we'll turn your location live.
Awesome.
But that is on Wednesdays.
Okay, sorry, I forgot to take that last slide. All right, and I'm going to turn it over to Dr. Parahon now. Do you want me to stop sharing?
Yeah, I'll do mine so it'll be faster. Okay, can everyone see that? Okay, great. So thanks so much, Miranda. And I'm just excited to kind of share some updates on community messaging. We've been doing a lot of work in the community, listening to people's questions and trying to answer them. So we thought we'd share some of these with you and then share the resource. I'll stick it in a link there so you can download it and get resource and utilize it for your communications. But basically it's a series of communications about boosters. And we can send that to, right, Chris, as an email to everybody. with the updates. So we have some questions that people have asked, like, why do we need a booster? And so there's like a series of common answers, you know, that we've had. So like having boosters does not mean the vaccine isn't working. Your chances of getting COVID-19 can depend on how much virus you're exposed to. Some people may be exposed to more of the virus by interacting with a lot of different people, and an extra dose of the vaccine can help protect people from infection in case they're exposed to more of the COVID-19 virus than others. So just kind of, you know, things that maybe it would help you with messaging. This shows the update on booster updates. So just sharing with people that all of them, Pfizer, Moderna, and J&J are all available. This is a you know, graphic on mix and match. So you can just see, like, you can get a Pfizer and then any of the other groups of vaccine, Moderna or J&J. So just kind of hopefully things that might help. Of course, we put boosters only there so people don't think they can mix and match their first and second doses. Here's some update on Pfizer or Moderna. So just a little graphic you can use, and feel free to print them out. And also I'll put, Miranda, can you put Liesel's email in? I know she can't be here, but Liesel Gonzalez is our vaccine community coordinator. She couldn't be here today, but she's developed all these slides so you can use them in the community. But Pfizer or Moderna, you know, gives all the, you know, categories, and then it shows you, like, you get your 2 doses and then you can get your booster 6 months afterwards, and it's in English and Spanish as well. Here's information about booster for J&J. We're just trying to improve the messaging just because it's been confusing for people. So why is the booster group for J&J different? Why is it 2 months later? And, you know, so we just have some messaging you can use, like being fully vaccinated with J&J isn't as effective as Pfizer and Moderna, and new data shows that people with J&J can be protected as much as Pfizer or Moderna by getting a second shot. So just kind of information you can use. Here's the information on J&J, so you can show, you know, you can get a booster 2 months later. Here's the one that Miranda just shared. So we just thought this might be helpful. Some common questions that people ask. And then on the right-hand side, you can see all the different kinds, like AstraZeneca, Covishield, you know, Sinovac, all the different vaccine types. You can share it with people in your practice. COVID-19 for 5 to 11-year-olds, just common questions. So we have the update on the, you know, FDA approving the Pfizer vaccine for 5 to 11. Today and tomorrow is the, well, is it today? Is it tomorrow? Oh, yeah. So today the ACIP and CDC is going to approve, hopefully, and then the MAT team will approve, and then we're good to go, hopefully on Thursday, perhaps. The kids vaccine will have a smaller dosages, so things that you can easily share with your patients. Kids 5 to 11 can get 2 doses of the Pfizer vaccine within 3 weeks. So just kind of information like that. We got a lot of questions like, why did it take longer for children's vaccine to get approved? So usually vaccines are tested first on adults. This is an added safety precautions. Children's bodies are different than adults. It takes time to determine the right dosage. The number of children in vaccine trials was increased to get more data before recommending shots, just things that can help parents feel more, you know, comfortable. And also the fact that the adults was approved first, so children is going to be a little bit later. But just things like that you can share with your patients. This is the piece that Miranda shared about the side effects for children. And then just more trust questions that people had. Does the vaccine cause health issues like myocarditis, pericarditis? How can we trust the vaccine is safe? So we have this, we have our flip chart. I can send you guys a link to that, just of common questions, but this is something you can use as well. And then this, yeah, Liesel did this, redid this several times, but just to help people understand what are the different phases, and that in each phase, we're always asking, is it safe? What dose is safe, right? Then they go to phase 2, expanded safety studies. asking if it's safe, and then the phase 3, the efficacy study, enrolling thousands of people to see if the vaccine works, and it's a large enough group to reveal more rare side effects, and then the continuing monitoring through VAERS and VSAT safe systems that track and monitor. And I know you guys already know this, I just thought it's helpful to, share that with your patients. Oops, sorry. And then this is, what about possible long-term effects of the child vaccine? So then we have the information sharing that side effects usually occur within the first 6 weeks. And then adult COVID vaccine started over a year ago, and trials have been going on in children since March. And we haven't seen a significant number of health issues in COVID vaccinated children or adults. And then just a reminder that other childhood vaccines made in recent history have kept kids healthy and safe. And then just some more updated information for you guys in English and Spanish. Here's one about finding out where to get the vaccine. Here's another one about how to add dependents to your profile. Thanks to Chris and his team to put that together. So the vaccinenewmexico.org/kids can really connect you to your kids' profiles. And then just another reminder that if you don't have internet, you can call our hotline between 8 and 8 p.m. to get scheduled. And if you're Spanish, you can dial 3 or 9 to talk to a Spanish speaker when you get to the hotline. But just kind of encouraging people to use the internet if they can, because we don't have that many people at the call center. And so just reserving it for people who have troubles getting on internet. And then here's some resources we have at DOH. Remember that you can still get an on-site vaccination event request. We have this until December 30th. And so you can request a vaccine site event, and you just fill out the form, and then we'll do our best to get to you in the community to help out with vaccines. And then we also have funding for a Better Together grant program. So if your clinic or your community orgs nearby want to organize an event and really get out to the community to promote vaccine, this is the website to get to for the grant. It's called bettertogethernewmexico.com. So yeah, I think that's it. And once again, thank you guys so much, for all you're doing in the community, for trying to, help us get out of this pandemic through the vaccine. So thanks so much. And then we're open to questions. And I'm going to put the link to the community materials on the chat box. So, okay. So yeah, do you have any questions? And happy to answer. And if not, there's
Hi, this is Carol with UNM Hospital. Hey, wondering, so I found where the PowerPoints are on Take Care New Mexico, but are the recordings somewhere else?
Oh, Chris, do we have the recordings here, or can we put up the recordings if we don't have them?
We have one. We can throw them on YouTube. I don't think that and then just link them. Will that work?
Would be amazing. Yeah, that would be great.
Yeah, that'd be great. I had a couple of people that weren't able to get into this Zoom today. They said that they were told, or they were given the message that it had reached capacity and they couldn't get in. So that's what they were asking about that.
Okay, let me.
Because a lot of times the PowerPoint is great, but there may be questions, or you may presenters may say things that then aren't really included in the PowerPoint. So different questions might get answered that way. So that's why I was asking. Thanks.
Absolutely. Thanks so much. Yeah.
Sure.
And I'm going to put the link for the PowerPoint from today here.
Mary Bell, do you want to go ahead and ask your question? It looks like you've got your hand raised.
I just wanted to clarify on I know you said to keep checking the websites for the expiration dates for the kids, because we did receive our children vaccine today, just a couple of hours ago. And the expiration date does look crazy. So I had heard it was 10 weeks out from when you put it on the refrigerator. We do not have an ultra cold freezer, so we have to put them on a refrigerator today. I just wanted to make sure if it was 10 weeks.
Yeah, yes. And Joelle, do you want to speak to that?
Yes, so when you put it into NIMSIS, you'll put in from the 10 weeks of your refrigerator. So that's what's really key important. For those who have the ULT, it should be showing up in the website as well, but sometimes again, things are still kind of moving and changing right now. So if you're still having difficulty with those, getting the official end expiration date, especially for the ULT ones, just send me an email or reach out to me and we can help you with those. But those ones are the 6 months usually. So, but those ones should be all updated on the website, but there may be a little bit of a lag right now because of things are not quite official yet. So things are changing. So, but as far as the Moderna and the J&J ones, I know Moderna is still trying to update all of their expiration dates and the website. If you do not see your expiration date changed when you look in, we have been advised by CDC to have you just go ahead and waste those doses and order some fresh ones. They're still trying to catch up on all those extended expiration dates, but if you don't see it, just go ahead and waste them and we'll get you some additional doses.
And the I know we've been saying expecting approval for the 10 weeks and not something that really made the news, but I did look at the EUA for the kids Pfizer, and it does say that, you know, that 10-week refrigerator storage was approved. So yes, and then that becomes the expiration date for that vaccine. That is true. Not 10 weeks from when you put it in the fridge.
Great. And then maybe I can share with people how to get onto the website for the Take Care New Mexico, unless you want to share that. Chris, do you want to do that or should I do that?
Yeah, here you can, let me,
Okay, we can do that. That
So if
one?
you go to takecarenm.org, and then up at the top, you'll see for patients, for providers. If you click on for providers, you'll see a banner at the top that says, click here for vaccine provider meeting updates, PowerPoints, and FAQs. If you just click that orange bar, that will take you to the location where all of the PowerPoints are on the right side. And then we'll get the video, we'll make sure that it's published so that you all can see that, but we'll get every video up there today.
That'll be great. Thanks, Chris. That's awesome.
Oh, that's why.
And there's another question, Joelle. Will NIMSIS have the ordered added for providers to receive? Tanya, you may not, I'm not sure I'm doing justice to the question.
No, so I went in and it's not in NIMSIS. And when I went in to do a self-receive, the dosage for the pediatrics isn't a pull down for Pfizer yet. So I can't.
Tanya, I'm currently working on screenshotting things for you, but so all of our first rounds of doses, so everyone who's getting their doses today, tomorrow, in the next couple of days. So since we had to order them directly through CDC, they won't show up as links in our IIS system, so you all have to enter them in manually. If you're having problems with that, go ahead and email me. I can walk you through those, or I can actually just do it for you if that's easier. The drop downs are in NIMSIS. Again, once you start ordering the 100s, you'll be able to, it'll just show up again as that hyperlink. So Tanya, I'll get you just some instructions over in just a second. Thank you.
And I've added, because I've done some of those before, but when I pulled down Pfizer, I didn't find the pediatric. It may just not be with the regular group of Pfizer vaccines. I couldn't find that. Everything was a 0.3 dose. I'll try refreshing my NIMSIS.
And then I see Valerie Griego with her hand up, and then Barb M. Sorry, I don't know your full name.
I'll go first. Would you go over where on the DOH website the resources are that you showed us earlier, the English and Spanish graphics and printable items?
Yes, yes, yes. Okay, so this is, I'll show you, it's our community vaccine site. So I'm gonna put that on the chat again, and I'll also show it to you guys. So we have a community resource website for community members, community health workers, different people who want access to that. So I shared with you the chat. There shows the Community Resource Center. Can you see that? And then it's kind of actually a really cool site because you can actually access everything more easily. We actually developed it with community health workers in mind who are saying they had trouble getting updates. So the updates have like the latest public health orders and latest information. Registration goes to, vaccine registration site, how to find the vaccine. Then you can also go COVID testing, monoclonal antibodies. And then for the resources, let's see, if you go to training, we'll have, let's see, the latest, let's see, CHW trainings. So the CHW trainings, which are every Wednesday at noon, will be located here. So that flip chart, and then these are the slides here. So that slide deck that I showed you, is really what we use for the community resource training. And so you can find that here. And then if they're like flyers, sorry, I don't want everyone confused, like it's so going by so fast. And then if you want like flyers, this will show you, go to the place where you can actually download vaccine promotion flyers. And we actually have a program that if your community organizations don't have enough money to photocopy or print in color, you can also, Miranda shared Liesel's email there. You can email Liesel, our vaccine community coordinator, to get access to promotion flyers or infographics, social media materials, and training materials. So you can get all of that. And I think that's what we have. So we're trying to get information to people that's easier to use, and you can download them off our website. But if you have anything that you're like, I can't seem to find the, COVID, Pfizer or Moderna flip charts or vaccine information, please let us know and we'll get that to you.
Great. Joelle, I think another one for you, which is the question is, I'm wondering if the expiration date you get off the website is for frozen, and when thawed, add the 10 weeks. So I know, yeah, go ahead.
Oh, okay. So the vaccine, so with the Pfizer pediatric, it'll be for the one that you get off the website will be for the completed frozen. So it's not you won't be able to store it for 6 months and then take it out and put it in for 10 weeks like we could do for the Pfizer 12+ one. So where you could store it in the ULT and then take it out to the freezer for 2 weeks and then 30 days in the refrigerator. So the expiration date will be for the ULT, but if you're gonna get it, most people will get it sent to them to be able to put into their refrigerator for 10 weeks. So you'll need to make sure you're adjusting that. So, yes. Does that answer the question? Sorry.
I think so. I was just laughing because it is incredibly confusing, but probably in the end worth it for having 10 weeks of refrigerator time, but.
Correct. And once we get, I just was advised that they don't have the official expiration dates out yet. That's why you're not seeing it. So those ones will come out once everything gets all official. So Don't worry about a NIMSIS right now. Just get them into your inventory. I'll continue to work with you all in the next couple days as we get all of that information updated and it officially comes out as approved by CDC.
Great. I think those are all the questions.
Did we get through all the chat questions?
I think so.
All right.
Right.
Great. Well, thank you everyone for joining. We
Oh,
really,
one more question.
uh-huh.
Will online consents be available soon?
Chris, do you want to take that one?
Sure. So online consents, if you are using the DOH consent form, are available in the app. So the patient, for anybody 18 years or younger or 17 years or younger, can fill out the form similar to the way they do the medical questionnaire. And we can review that on Thursday, but that should be available in the app.
Hey,
And it
Chris, is there a
Pops up. Okay.
Oh, sorry. Chris, is there a way to download those also as a PDF? Is that an easy thing to put as well on
The public has the option for both. So they can
Oh.
either do it online and or download it and bring it in.
Okay, thanks.
And I was going to say it pops up for the patient at the time of scheduling the vaccine, not registration.
Correct.
Yes. Okay.
So they schedule and then they've got to fill out the online consent.
And we are, for anyone who has schedules, like you can put the schedule in, it won't open until we have that CDC approval. So, but hoping, so again, thinking that the CDC director will sign off on Wednesday night, which is usually what she's done after ACIP meets, and then Thursday morning we usually have a brief time for Matt to review, but we'll be ready to roll and open up scheduling at that point, as well as get the HAN out and for DOH folks, update our vaccine protocol or send out the updated one.
And then last question says, can we see if the consent is signed on our side through the provider portal?
Yes. So in the grid, we're hoping to have that either today or tomorrow. Similar to the medical questionnaire being completed, you'll be able to see yes, no for online consent, or not available if they're over 18 and don't need it.
Thank you, Chris.
Mm-hmm.
Great. Well, if we don't have any more questions, thanks again for joining us, and thanks for all you're doing in the community. And I guess you'll be with Chris. Is that Thursday, Chris, or
Thursday? Yes.
for the app?
Yes. Thursday at noon. If you have questions about the app and or the new functionality that's coming out. Okay, guys, thank you for everything you do. We'll talk to you all soon.
All right.
Bye.